So I'm going to be changing my patient's wound. I have walked into the room, verified my physician's orders and my patient. I've performed hand hygiene and donned clean gloves. So now I'm going to take off this old dressing. I'm going to do that by wrapping the tape underneath it. And while I'm doing that, I'm going to look at the dressing and I'm going to look at the wound, look for any infection, look at the exu date and see what it entails, and then I'm going to fold it and discard it in my biohazard bag. I'm going to discard my gloves, perform hand hygiene, and put on new clean gloves. So here I have my supplies. I have an ABD pad that I'm going to open away from me. I have my gauze that I'm going to open away from me, my tape that I've already set up, and then my saline that I have put in my hand with the label facing my palm. I'm going to lip it into the trash, and then I'm going to soak my gauze in the saline. Now I'm going to take my gauze and fold it into a sort of a wonton like this, and now I'm going to wipe away from the wound to the outside on the farthest side of the wound from me. And I'm going to keep doing that. Wipe to my body. Then I'm going to continue doing that. And wipe towards me. So for time purposes, you would continue doing that down the whole length of the incision, and then you would dry in the same manner by making a wonton and then going back and forth, grabbing new gauze, wiping away from you. And so now I'm going to put on a new ABD dressing by taking on the new ABD, placing it on the incision, and then getting my tape and placing it on all four sides of the ABD pad. And so usually you'll initial and date when it was changed. And after that, I would discard my gloves, perform hand hygiene, and then document the procedure, how the patient reacted, and what I saw on the incision and on the old ABD pad.